Hello viewers, I am Dr. Kona Himabindu Reddy, Consultant Pulmonologist, Pratima Hospitals, Kukatpalli. In this video, I am going to discuss about few points about the flu because season is changing and all of us will get flu infections in the coming season. So the flu is the type of respiratory virus which is also known as influenza virus. There are different strains among the influenza viruses, and one of them we commonly known as H1N1, so which is also known as swine flu, which has caused a pandemic few years back. And these strains are commonly named as type A or type B. And when we breathe in the flu virus from our surroundings, the virus enters into our nose, throat and lungs. And sometimes it causes upper airway infection like flu-like illness, and sometimes it enters into our lung and causes pneumonia. So what are all the symptoms that are suggestive of flu illness? So the flu happens suddenly and it presents with high-grade fever, chills, headache, body pains, muscle pains, tiredness, weakness, runny nose, stuffy nose, and sore throat, cough, dry cough or with wet cough, and sometimes even breathing difficulty, loose motions, especially in children. So when you have the following symptoms, just meet your doctor and take the proper healthcare provider advice, and he takes proper history from you, and after taking history, he suggests you a symptomatic treatment to relieve your symptoms like fever, headache, running nose and cough. And he advises to take plenty of water to avoid dehydration and to take adequate rest. And sometimes the people who are at high risk like young children, pregnant women, nursing mothers and elderly persons above 60 years of age, and the people who have diabetes, lung disease like asthma, COPD, ILD, and heart disease, kidney disease, liver disease, and also who are on immunosuppressive medications like steroids, and who are on chemotherapy and radiotherapy for various types of malignancies, and who have been suffering from HIV or AIDS, they are at high risk of developing serious disease, serious illness. In that case, the virus enters into your lungs and causes severe pneumonia, and it may lead to the acute respiratory distress syndrome, which needs hospitalization, ICU care, oxygen support, and sometimes non-invasive ventilatory support and ventilatory support. In those cases, it sometimes causes even death. So, whenever you have flu symptoms, don't ignore the symptoms, meet your doctor as soon as possible, take the treatment immediately. So, how can we prevent the flu illness in this coming season? The most common preventive measure is a vaccination, flu shot. So, the flu vaccines are available in the market. There are two types, tetravalent and trivalent. Tetravalent vaccine protects against the 4 strains of influenza viruses, and trivalent protects against 3 strains of influenza viruses. So there are 4 common ways of administrating the flu vaccine. The first one is a flu shot, which is most commonly advised by the healthcare professionals. The flu shot is given into the muscles of the arm, and it is recommended to the children above the age of 6 months and all the adults and elderly people. And it cannot cause any flu illness after taking vaccine. And another one is flu micro shot. So it is given under the skin of the arm, and it is advisable, recommended to the age groups of 18 to 64 years of age. And another vaccine, another brand has come with jet injector. So this can be administered with high pressure of liquid which penetrates the skin without injection. And another form is a nasal spray. The flu vaccine is administered through the nasal spray into your nose, and it contains live attenuated vaccine rather than killed vaccine. So it doesn't cause any active infection, but it is not recommended in the pregnant women and who have been suffering from various lung diseases and who are on immunosuppressive medicines like steroids, chemotherapy, radiotherapy and other medications connective tissue disease. This vaccine is not recommended. So before taking flu vaccine, consult your healthcare provider and take his advice. And if you have any allergy to eggs, inform him immediately, so that better to take flu shot in the hospital setup, which can provide you immediate treatment if you develop any allergic reactions after taking vaccine. And in the children of age group of 6 months to 8 years of age group who are first time getting vaccine, they need 2 doses at least 4 weeks apart. And who have taken first dose only single dose, they also need 2 doses in this session at least 4 weeks apart. So in this way, the flu vaccine will prevent the serious flu-like illness in the coming season. And what are the other preventive measures that are available to prevent flu vaccine? So the other preventive measures that we have to follow to prevent flu illness are: wash your hands frequently, use soap and water or alcohol-based hand wash, and also always maintain a distance from the persons who have been suffering from the flu-like illness or flu symptoms. And also cover your nose and mouth with a napkin or kerchief, so whenever you are sneezing or coughing. And also eat healthy food and do regular exercise and avoid smoking, which definitely decreases your lung defensive mechanisms and making prone to more severe lung infections, especially flu-like infections. And also always keep your underlying health issues like diabetes, asthma under control. So in this way, in addition to flu vaccination, the following above measures, preventive measures, we can prevent flu vaccine. And what are the important symptoms that definitely indicative of hospitalization in the person who have been suffering from flu symptoms? In addition to fever, when the patient has breathing difficulty or pressure in the chest or chest pain or dizziness or confusion or any drop in or fall in saturations, then definitely you have to meet your doctor immediately and you need hospitalization for flu pneumonia. So by following above measures, definitely you can prevent severe flu illness or severe flu infections in the coming season. So get your flu shot immediately. Thank you.